Just this year, a discovery was made in northeast North Dakota. A potentially life-threatening disease has made its way to Grand Forks County for the first time ever. UND professors and Lyme disease researchers Jefferson Vaughn and Catherine Brissett are here with us today to discuss how they discovered the threat. Thanks for being on the show with us today, you two.
Thank you.
So for the first time ever, we have rodents on the table with us. But before we discuss that, I have a couple other questions for you. So, starting out with Jeff, what prompted you to start researching Lyme disease?
Well, the thing that prompted it was going to the veterinarian with my dog, and the veterinarian brought to me these ticks. He said, "These ticks look very strange. Never seen these type before." So I took them back to the lab, and the veterinarian was correct. These were ticks that were not known to occur here in North Dakota. They were deer ticks.
So it's never been in Grand Forks before then?
And as far as we know, no.
Okay. So can you describe the ticks a little bit that do carry the disease?
Well, these ticks are a lot smaller than the ticks most people are used to, and they're very dark-legged. In fact, they're sometimes known as the dark-legged or the black-legged tick.
Mm-hmm. Now, there's some pictures up here. They look like they're a lot smaller than I expected.
Much smaller.
I mean, how big and how small can they be? I mean, what's the size usually?
Well, they're probably about half the size of the ticks that we're normally used to seeing.
Mm-hmm. So they can be like poppy seed size,
about
maybe?
Poppy seed, yeah.
Okay. And how do they latch on then? I mean, do they have parts that kind of
Oh, yes, yes. They have a very nice centrally located organ that they use. It has tooth, and they dig it into your skin.
Kind of looks like a sawtooth almost on there.
Very much so, very much so.
It's interesting. So how can these ticks are found in other Midwestern states as well, correct?
Well, they're found in the forested parts of Minnesota and Wisconsin.
Mm-hmm.
So yes.
Are those kind of the hot spots then, or?
Those are that's one of the main hot spots for Lyme disease, and is the Wisconsin and eastern Minnesota. The other hot spot would be New England.
Okay. So now, how did you two test these ticks then? If they're so small. If they're so small, how did you test them?
Well, we had a graduate student go out there and catch rodents, and he would pick the ticks off the rodents and then bring them back to the lab, and then we chop them up, and then we assay them for the germ.
Now, these are some of the rodents up here?
These are some of the rodents that that are out there running around right now.
Can you tell me a little bit about them?
Well, yeah, there's two sets of rodents. The ones we see now, these are the short-tailed ones. These are called the voles, okay? And they carry a lot of ticks on them. The other type of rodent we have are the white-footed mice. Now, white-footed mice are the normal, regular carrier of the Lyme disease.
Okay, common in the Midwest?
Common in New England and known to occur in the Midwest as well.
Okay. Now, Catherine, is the disease easy to contract?
So in eastern North Dakota, probably 5% of these particular ticks will carry the bacteria that causes Lyme disease. So the risk is still relatively low. And you also have a grace period. So if you do get bitten by a tick, it takes at least 24 hours, perhaps even a little bit longer, for the bacteria to travel into the bite site. So if you check yourself for ticks every day and remove any ticks that you do find, you significantly reduce your chance of getting Lyme disease.
Now, from what I understand, there's kind of a proper way to remove them. How would you take one off if you did find one latched onto your skin somewhere?
So the best way to do it is with tweezers, or if you have nice, short, sturdy fingernails, and grasp the tick very close to the skin.
Fairly tight?
Fairly tight,
okay.
And just a quick pull. And you'll probably get some skin comes off with it too, but that's good because you want to remove those mouth parts, those sawtooth that you saw earlier. You want to remove those from the bite.
Now,
you don't want to.
Twist?
No, just pull straight up. You don't want to put Vaseline on the tick. You don't want to burn them with a match. Just pull them out.
Okay. Now, when is the peak time for this disease to be contracted then?
So there's 3 life stages of the tick. There's the larvae and the nymph and the adult. And most people are bitten by nymphs, and nymphs feed generally in the summer. So perhaps late spring as well, but generally nymphs are out looking for something to eat in the summer.
June, July.
Exactly.
Okay. So what are some symptoms if someone did think that they had Lyme disease? What would they be seeing?
So the early symptoms are very nonspecific. People will feel, kind of flu-like symptoms. You just feel kind of run down, kind of achy. You might have a headache, joint aches, muscle aches. One of the real telltale signs of Lyme disease is a particular kind of rash. It's often referred to as a bullseye rash, but it's a kind of a spreading rash, It doesn't itch, it doesn't hurt, but at the site of the tick bite, you'll get this red rash that expands.
Okay.
And that occurs in about 60% of people who contract the disease. So if you have that rash, that's a pretty good indicator that you've contracted Lyme disease.
Okay, so now what can the disease do to your body then?
So these bacteria are really good at spreading all throughout your body, but there's particular places they like. They like your skin, hence the rash. They like joints. So about 60% of people who don't get treated will develop arthritis.
Okay.
Really huge, especially in the knee joints. These bacteria also like the heart, and so people can get inflammation in their heart. That can be quite severe. In fact, that's the only way that you can die from Lyme disease is from the cardiac manifestations. And they also like the nervous system. So they can cause things like, there's something called Bell's palsy, where half of your face will be paralyzed.
Wow.
So it can be quite serious.
Severe. All right, now Jefferson, last question. What is the best way to prevent catching Lyme disease?
Well, the best way to prevent catching Lyme disease is just do your tick checks when you come in from the woods, okay? Now you should also know that this particular tick is a forest tick. So if you're in the forest, that's the time to do your tick check and remove the tick right away.
Great. All right, thanks for being on the show with us today, you two.
Thanks
Thank
for
you so
having us.
much.